Good afternoon, good morning, and welcome to Let's Talk ACA with JSA. I'm Kathy Wilson, and joining me, my co-host, Alex Farron.
Hi, Kathy. How are you today?
I'm good. How are you doing? Happy 4th.
Yeah, happy 4th of July. Hey, you look great. Your hair is very swoopy today. I like it.
Look what I'm wearing.
Ooh, the community agent shirt. You cut off for a moment there, but you look good. There it is.
Thanks so much.
Are you on your phone today? You're a little bit laggy.
No, I'm in a empty studio right now, doing some work. So there's a bit
Oh,
of an
okay.
echo.
Cool. No worries. Well, let's get underway. We do have a special guest with us here today who I'll introduce in just a little bit, but thanks for joining us, Carl. I see you're on as well. A few housekeeping rules before we get started here today. If anybody, first and foremost, is experiencing an echo with the podcast, we've been noticing that for whatever reason, Zoom has been opening up multiple instances of the webinar room for some people recently. So if you're experiencing an echo that is unfortunately likely on your side, just check if you have a second instance open and that should take care of it. Next, the webinar today will be recorded. Everyone who has joined or registered is going to get a full copy of the recording, including the video and the chat. So don't worry about taking too scrutinous of notes as we're going through here today. We got a little bit of light content for you before the holiday weekend anyhow. So no worries. We'll be following up with all of you either this afternoon or tomorrow with the full recording and some other great resources for you. If you do find that you're able to speak or have your camera on during the podcast, do please refrain from doing so. We have the chat and the Q&A functions available. If anyone has questions throughout the podcast, just put them in the chat, put them in the Q&A, and boom, we will have those answered for you as we go along, or some Q&A at the end. So without further ado, let's jump into it. What are we talking about today?
Let's talk ACA.
Let's talk about it. All right, so here's what we got on the docket, y'all. First off, we're going to just talk about some practices, a little bit of reiteration like we always do month to month to keep you guys on top of things and in the loop. But what our first topic is we have kind of a prevalent scam, for lack of a better word, that I've been hearing about. And Kathy, I think you mentioned this as well.
Yeah, so agents have been calling in and beware. A lot of us have different lines of businesses where we teach our customers about the scam world. Well, now it's happening to us. So if a client reaches out to you, probably via virtual, and insists on hosting the Zoom or conference call, however you do it, it's a scam. So make sure that if the client reaches out to you, you host the Zoom call and you initiate the call.
Yeah, absolutely. So we're going to go over all of that. We have a great update for you guys, and I have a bit of a concrete example of an email that some of our agents received. Also, joining us today is Peanut, the ACA cat. She's making another appearance. So everyone say hi to Peanut. She wants to join us today. She wasn't here last month, but I guess today she's awake and at it. She's ready to talk about under 65 insurance. So thank you, Peanut. Your face is going on a shirt at some point. All right. The other thing we have to talk about today is the CMS final rule for 2027, better known as the Notice of Benefits and Privacy Practices, kind of the governing rule, for anything involving the ACA and the changes from year to year. But we have a little bit of an update to that. Then we're going to do our product spotlight segment with Allstate. And at that time, I will introduce the illustrious Carl Bernard to go over everything that they have available for you guys in just about maybe 10 or so minutes here. So let's jump in.
So, Alex, when they say final rule, is it the final?
I think they like to think it is, but like we kind of talked about a lot last year, Kathy, it's never the final rule. Things change with the ACA even more so than Medicare. It feels like sometimes up to the final minute, and we may see that again this year. So, buckle up, partners. We might have some changes coming in hot down the pike here. So, we want to just talk about that today and what we can expect. So, as we jump in, some mid year best practices, which we like to talk about from time to time. ACA rate increases this year, it was no surprise that they were very high in a lot of areas due to a combination of the plans increasing as well as the subsidies across the board being decreased. So, what can we do here for our clients? Not only is it a good time to follow up with your clients middle of the year, hey, Mr. Mrs. Client, has your income changed at all? Is that plan still working for you? How's your subsidy looking? Kathy, what can an agent do to help a client adjust that mid-year?
Well, make sure you have those check-ins because it's the annual estimate and you still have time to change it. So you don't want them to be at the end of the year and have a big surprise.
Absolutely. So you as an agent, you can work with your clients where they can adjust their income mid-year or really on a month-to-month basis with an ACA plan to make sure that subsidy is staying current and they're not getting hit with some kind of surprise at tax time. It's a really great way to check in and build that relationship and just keep things current with that client. And not only that, but when you're checking in with these clients, it's a great time to also work some cross-sell. If you have a client and you say, hey, have you been using your plan? Is there anything that you've experienced that's a bit of a pain point? Maybe they've paid $1,000 into their deductible and they have quite a bit to go. Offer them an accident plan. ACA and under 65 insurance is rife for the cross sell. You have so many products that can be utilized alongside these plans. My favorite of which are the accident, cancer, critical illness, or hospital indemnity. Everybody needs dental vision. Telehealth is becoming more popular. You have a bevy of options that you can offer to these clients. And if you're a little unsure about how to do it or what is a good choice for them, get in touch with us. And I think we'll even have some solutions for you yet today in the form of Allstate's product suite. And so not only that,
So we
yeah,
have a bonus going on for cross-selling for the ancillaries I just saw that JSA put out. And there's going to be a webinar next week for hospital indemnity. So if you don't know, get on it so you can know.
that is a fantastic plug, Kathy. We'll have some resources for you guys available in the follow-up email if you want to join in on that. But if you aren't familiar with hospital indemnity or some of the options available out there, it is a great time to learn a little bit. We're doing tons of monthly webinars where you can pick up some tips and tricks on these products and how to offer them to clients. So certainly get in touch with us and join that webinar next week. That will 100% be worth your time. So in addition to selling that, what's the easiest thing you can do is just ask for a referral. It is the greatest compliment an agent can receive when you refer somebody to your family and friends. So say, hey, do you have any brothers, sisters, aunts, uncles, children, family members, community, friends, anybody that I could help find affordable health insurance in these times where everything feels like it's getting a little bit more expensive. So it is a great time to help somebody out and then say, hey, is there anyone else you know that I could help out as well? Don't be afraid to ask for a bit of a referral from a client. So moving right along. After open enrollment here, we're about 6 months into the year, 7 months, with it being July 2nd today. This is the time for SEP enrollments, and not only SEP and cross sell, maybe looking at short term medical for some clients that had higher premiums, but now is the time to prepare. Kathy, what would you say is the best first couple of steps that an agent can take if they want to get involved in under 65?
So interesting you bring that up. So what we do know is if you're in a federal state, at this moment, it is closing for the certifications. So you'll have to wait until August. And we don't know the date yet. They'll let us know and we'll let you know when we can start certifications for August for 2027 open enrollment. So if you've already gotten your certification, the next best step is to call us, email us, find us, and we will answer, I promise, so that we can start your contracting. And just a caveat, I'd like to tell agents, contracting for ACA is a journey, and we're here to help you through it, but please be patient.
Absolutely. Couldn't have said it better myself. Now is the time to prepare. With everything happening during the summer, new plans getting released for Medicare, certifications, carrier contracting, networks getting switched up, don't be late to the game. If you're able to contract now, now is the best time to get prepared. My recommendation with the ACA is that things are always a little bit of a mixed bag, right? We don't know until the 11th hour which plans are looking good, which are going to be competitive, and the ACA is so standardized that usually things are sold on price. Best thing you can do is contact us. We can give you some kind of, historical data, for lack of a better word, of what we have found to be competitive in a certain area over the last couple of years. Usually things tend to remain sort of the same unless somebody comes in hot with the ACA. So I say get ready to go with maybe 2 to 4 carriers in your area that we have a good chance of being competitive. That way, when it comes down to it, you have everything that you need to be ready to go. So
What
as
if
we
there's no SCP, Alex?
That's a great question. So, I saw it asked here in the chat if we ask for referrals, we can't enroll somebody unless they have an SEP. Absolutely correct for health insurance. You're going to need to have an SEP to enroll right now in the middle of the year. But what do you not need an SEP for? Those ancillary products that we just talked about. Get your foot in the door right now. It's a great time to build a relationship through the cross sell. Maybe somebody already has a health insurance plan that they're happy with. That's fine. We don't want to mix it up if the client is already doing well. However, maybe they live far away from a hospital and they could utilize a telehealth service. What if they don't have dental and vision insurance from their current agent? Maybe they have a history of cancer in their family and a cancer or critical illness plan would be perfect for them. These plans are usually under $50 a month, cover the gaps in our health insurance, and it is a good way to get your foot in the door leading up to open enrollment, when you can then make the move to really help build a relationship with that client and keep them on your book of business. Cross sell makes sticky clients, it adds to your revenue, and it's the great way to really just keep that business rolling in. So now don't only ask for referral, ask for a cross sell referral. If you know anybody else that can maybe use a cancer plan that I just sold you for only $20 a month, not too expensive. Everyone has a need for it. I think the scariest statistics, unfortunately, are about 1 in 2 men and 1 in 3 women throughout the course of their life will develop some kind of cancer. I'm not going to risk those odds, that's for sure. So I'll be getting myself a cancer plan in the next few years, actually. So as we move along here, we got 2 quick segments before we get in. So this is what we were talking about first and foremost was this kind of scam that we've seen pop up. And I have an example for you guys so you know what to look for on the next page. But it's like Kathy described. Basically, you're going to have a client, quote unquote, reach out to you. And they're going to say, hey, Mr. Mrs. Agent, whatever, can we please review the options for my health insurance? I want you to be my agent. Let's get in touch and we will absolutely go over those. But then what they'll do is they'll say, hey, instead of a phone call, can I send you like a Zoom or a Google Meet invite to review the options? They're usually being sent from Gmail addresses, and oftentimes that link will ask you to download something. Even if you already have Zoom or Teams or whatever installed on your platform, it's going to say, let's download this, and then they're going to ask you to actually execute that file and start the program. Kathy, anything else to add before I move on to the example?
No, just be very, very cautious, guys. Fortunately, I haven't talked to anybody who it's affected, only the ones that have caught it in time. Just make sure you're doing your malware, whatever security you have, so that this doesn't ruin anything going into AEP.
Absolutely. Make sure that your firewall, all your virus protection is up to date. If you aren't sure how to do that, we could probably answer some basic questions for you, but that's why we have our own IT team. So just make sure that you're good and secure. So let's dive into the example here so that you guys know what to look for. So this is actually an email that I received from an agent of ours, and I've tried to remove everything I can. To make sure that we're just showing what it looks like here. But let's look at the top first. It's from a Jennifer Malott. Kind of a strange last name, but maybe you guys know some Malotts out there. But as you can see, it comes from a Gmail address. If you guys don't know, you can set up a Gmail address in about 5 minutes. Really easy to do. You don't need a lot of verification. And they're saying health insurance. Hi, I'm looking for health insurance in all capital letters, Milwaukee, Wisconsin, and would like to review my option. Are you able to assist with marketplace plans and subsidies? Please let me know what information you need for me to provide a comparison of plans. Pretty innocuous, pretty innocent. Just reaching out. The odd gap in the spacing with Milwaukee, Wisconsin would throw up a little bit of a red flag for me as a kid who grew up on the internet. But, all in all, pretty normal email. Then she follows up. Look at the bottom here. Hey, we're on a Zoom call. Are you able to log on? Here's the link. Take a look at that link first and foremost. This is something that I want to teach you guys if you aren't super familiar with this. So it is a meetlive.es/joinzoom.us. Now, if it was joinzoom.us normally, that's kind of your regular Zoom link. However, what throws up the red flag for me is that meetlive.es. Who knows what ES stands for? Well, I don't exactly know myself, but if I had to guess, it would either be Spain or Estonia. That is a worldwide URL, not a .com. For example, Germany is .de. So this would either be España or Estonia. Coming from a foreign country, we work internationally nowadays with a lot of the carriers we work with. They have, customer service abroad. However, coming from a client with a Gmail address asking for a subsidy in a US based ACA plan, that's kind of a strange thing. Then, not only that, but this person appears to be a tech guru. They have the instructions perfectly laid out, point by point. Even looks a little bit like AI word processing, if you ask me, about exactly how to join not only from your PC, but from your phone. So, what are we taking away here? One, if it's from a Gmail address of somebody that you don't know, that's not reputable in the slightest. Anybody can create one of those. Then, if they're sending you an invite, whether it's Google Meet or Zoom, which are the two most common, check the URL. Don't click on that thing right away. Make sure that it's coming from a US based address, not a .es or any other kind of worldwide domain. And more simple to the point, just don't even join it. Send it to the client yourself if you want to do some kind of video conference or meet. Most people would even have an iPhone or an Android phone and would be able to do something over their phone with a video chat option. That would be much more common. Kathy, in your experience as an agent in the past, what would kind of be your recommendations for setting something like this up with a client?
I would initiate it because, Alex, none of us are looking at the URL address when we hop on a Zoom, right? It's just like, especially today where I'm running, doing 50 things and jumping on here, I didn't really even think about it. So
Great point.
it may be too confusing for us to even go down that road. So if someone contacts you like that, I mean, how many of you guys get emails for strangers needing health insurance? I don't know. Maybe it's happening, but if you are, you're lucky. Maybe you have some campaign set up that way, but that will help vet who's coming in and, try to vet them before you communicate with them. I'm even leery about the email itself, because we have security here on our jobs and we can't open certain emails because they could be virused.
Absolutely. Yeah. Best practice is just to initiate it yourself, especially as we get busy during open enrollment. I would expect to see more of these. And what we believe is that they're able to just pull the agent data from the marketplace locally. So it's very easy to find agents that are ready to sell ACA plans through public resources. So be aware, be on top of your game. Make sure you're not doing anything like this open enrollment that would compromise you from making sure that you and your clients have the best experience with everything that you do to help people out. All right, moving right along. This next section, I just want to quickly go over the CMS final rule again. We already talked about this last month and we're going to be talking about it again, but we have a bit of an update and then we'll be moving on to our product spotlight segment. So, long and short of it is that every single year CMS introduces the rules that will govern Medicare and the marketplace or whatever changes are kind of going to get updated. To go over it quickly, we had a few changes announced for this year. Most important of which for agents are going to be the following. There's going to be a standardized consent letter for anybody working on the marketplace. SCP and income verification is going to get a little bit more stringent. There's going to be FFM training changes. AKA you just have to do it through CMS like you're already doing. You're not going to be able to do it through a third-party platform. And there's going to be a shortened open enrollment, most likely to December. So that's what we know. But wait, stop. Kathy,
There's more.
you sent me this morning, which was a great heads up because it gave us some content for today that is actually really good to talk about. If anybody remembers last year, we had a district court ruling in the state of Maryland, specifically the city of Columbus versus Kennedy, the director of Health and Human Services, saying that some of the provisions in the final rule were basically unlawful based on another statute. That was called Columbus 1. We're now seeing the Columbus 2 lawsuit, essentially alleging the same thing. Hey, these changes put forth in the notice and benefits and privacy practices are unethical. They're going to make it harder for people to get health insurance, raise costs, and just cause a bunch of waste in our system that we don't really need. So what they're targeting is that SEP and income verification, the introduction of quote unquote non-network plans in the marketplace, and some of the eligibility changes, specifically, I believe the one that they cited was for lawful residents under a certain income amount that didn't qualify for Medicaid not being able to take the marketplace plan any further. So as it stands right now, we don't know how this is going to go. This is an in-depth proceeding that is currently taking place. As you can see from the headline that I pulled, the last update was just a few days ago. So we're going to see actually how many changes take place this year. And Kathy, historically, what happened last year?
Put them out, they take them away. They put them out, they take them away.
I know, back and forth, back and forth. Who wants to dance with me this year, HHS and CMS? We'll see what happens, I guess. So be aware of it. We're going to talk about it as we go through the next few months. However, just know that we may see again a bunch of proposed changes that don't actually take place. So stay with us every month. We'll keep you up to date on the situation.
We
Anything
have a
else
good
to
one
add?
coming up too, Alex, that right now we have to do a three-way call, which could be lengthy, 15 minutes, 20 minutes when a busy season for CMS to change the agent of record. Going forward, they have not put out the instructions on how we're going to do this, but the client's going to authenticate the agent if there needs to be a change.
Yep, absolutely. So again, just keep up with us. We're gonna make sure that you guys know exactly what's happening with the ACA and what you need to be doing and what you need to be aware of. So without any further delay, we have our segment today, which is the product spotlight. And I want to introduce our Allstate rep, Carl Bernard. Carl, are you here with us?
I'm
Hi,
here. Thanks for having
Carl.
me, guys.
Yeah, hey Carl, how are you doing today?
We're doing great. It's a beautiful day here in Wisconsin.
Hey, fantastic. All right, so at this time, what I'm going to do is I will pass the buck to you, Carl. If you want to go ahead and screen share and take us through what you have today, please feel free to do so, and I will let you go for it.
You got it. Let me share my screen here. Alex, you can see the full screen, right?
Yes, I can see Allstate
Awesome.
Health Solutions. Take it away.
Perfect. Perfect. Well, thanks for having me, guys. I'm excited to be a part of this week and this month's product updates and trainings. I think all the info and content that you guys provided already was hopefully super helpful and of great value. And so what I want to spend a few minutes with you today is just connecting you to the products that you have access to through your partnership with JSA, right? And so my name's Carl Bernhard. If I haven't had the chance to connect with you yet, I would love to. There's my email address and phone number. And I just wanted you to see our team. Sarah's been working with me for a long, long time. She helps on a similar sales capacity as I do. And Kathy is our sales assistant. And so she helps more on the licensing and commissions and things like that. But wanted you to make sure you had a way to connect with us. If you get nothing else out of this presentation, know that we want to work with you. We would love to help you. And between the three of us, we have over 70 years of experience now in this industry. I say that humbly, but we know what we're doing. We've been doing it a long time. I started in 2006. And for a lot of people, I'm the rookie in the room still. So hopefully we can be of help to you and your client base moving forward. We're going to spend our time today really focusing on short-term medical. But before we do, I did want to just show this slide to make sure agents knew what was available to them through their contract at Allstate Health. All right. So we like to say we're kind of like a Swiss Army knife. We have solutions for all ages and solutions for all agents. On the under 65 side, obviously short-term medical, but we do have a fixed benefit product called Access. We have a new product called Medical Expense Shield in select states that I'd love to have you guys take a look at here at some point. Basically, it's mirroring a short-term medical with a fixed benefit plan. And then a whole suite of under 65 supplemental products, like Alex was talking about, right? Accident plans, dental plans, critical illness, cancer, heart, stroke, hospital plans, term life products. Now's a great time of year. In fact, I was with a large group of agents a couple weeks ago in Indiana. And, that was my encouragement to them was June, July is a really great time to connect with your clients. How's your plan doing? How are things going? Have you had any, income changes? All of the things that you could kind of reconnect with and have a mid-year touch point. Hey, I just heard about a new dental plan that could be a really good fit for you, right? It could be a good segue into cross-selling a new product for them. Also have a suite of supplemental senior market products, dental vision hearing, accident cancer, and a senior indemnity plan. So would love to get more information to you on any and all of those. But for today's presentation and time together, I really wanted to focus on short-term medical. Alex did a really good job connecting in a webinar not too long ago for you guys, all about short-term medical, the ins and outs, what it covers, what it doesn't cover. So if you need to get that one sent over to you, I'm sure he'd be glad to do it. But I say that to say I'm not going to read every bullet point on this slide. We're heading into a fun holiday weekend, and I want to keep this light. But just so you know, short-term medical is a really good fit for some clients. All right. It's not the right product for everybody. And any carrier rep who tries to sell it that way, I would argue they're probably not doing their job the right way. This is a really good product for someone who I would say is healthier in nature. They can answer a few health questions in order to qualify. And pre-existing conditions are not going to be covered on short-term medical. So the plan's really designed to cover new illnesses and new injuries looking forward. All right. But obviously, it's someone who maybe is outside of an open enrollment period. They don't have a special exception to happen right now. Maybe they're waiting for benefits to kick in. Maybe they're trying to bridge the gap until Medicare, right? Maybe their ACA premium went up, like you guys were talking about earlier. Based on the FPL percentages changing this past open enrollment. Those are all potential reasons why someone would want to consider short-term medical compared to an ACA plan. A few of the key highlights on our product that I wanted to highlight today. The biggest one is our network, guys. We get compliments on this network all the time. The Allstate Health Plan has actually, depending on the state you're quoting in, 2 network options, Aetna and Cigna. Aetna is by far the most popular. It's the Aetna Open Choice PPO, and that allows your client to access more than 2 million doctors and specialists and over 36,000 hospitals across the country. This network is really, really great. You compare that to some of the skinnier HMO style products that are available through ACA, and the network discounts alone can average up to 40%. So we see a big value in being a part of a PPO network. And so I just wanted to lead with that. All right. We also have some discounts available on our short-term medical plans, up to 40% off. About 20% discount if your client can qualify for what we call a preferred rate. It's a couple extra health questions that you'll have to answer in order for them to get it. And then about another 20% discount if they can do a single premium payment. These are for plans that are 12-month terms or less. We can offer a 20% discount if they can pay for it all at once, right? Completely understand and recognize not everyone can do that. But if they can, if they want to throw it on a credit card and get some points or whatever the case may be, those are some ways to bring these affordable products down to an even better price point. We like to say it's a simplified issue product. So you're going to know at the time of application whether it's pass or fail, right? So you check the boxes yes or no, it'll give you a response right away. We do have a guaranteed issue option in many states throughout the country. It comes with some reduced benefit amounts, but if your client is stuck mid-year here and has nothing, it might be something to consider. I'm not going to read every one of these to you just based on time, but just know a lot of these short-term medical plans in our current environment can be sold for up to 3 years of coverage at a time. Okay. Some of that depends on the state, right? And I'll show you a map here next on where we have what products available. But if you have a 3-year plan available in the state your client's in, we do have a rate lock option, meaning your client's going to know for all 3 years what their price is going to be. I don't have that on my own health insurance, and I'm sure you don't either, right? So it's a really nice way for a client to be able to budget in an environment that is super, super confusing and super messy. All right. Next day effective dates. We do offer child only plans with most of our products that are on the shelf. And so we do a lot of child only business here. And we do a bundle billing. So if you were to sell a short-term medical plan with us and an accident and a dental, you're going to get one bill. Your client, I should say, is going to get one bill for all of those. You're not going to get 3 separate charges, 3 separate times of the month, some stuff that we hear causes headache elsewhere. All right. Pre-existing, like I said, not covered. Maternity, not covered on short-term medical. But like I said, for the right client, it's a really, really great fit. Here's that map I mentioned, okay? There's a lot going on here. Fully recognize it. But the states in green are states where we have a 3-year short-term medical plan on the shelf today. Many other states, we have a 12-month plan. And Texas, I know Texas is a big state for many agents and obviously us as well. It's a 3-month plan that can be sold. It's called a 3x4. So with one application, you can get up to 12 months of coverage there. We expect that to shift here at some point, and if and when it does, we'll offer a 3-year plan there as well. This is a snapshot of our brochure. I'm not going to read all the details to you, but know that we have 3 levels of coverage. And the basic one's called Essentials, the middle one's called Enhanced, and our top plan's called Copay Enhanced. Obviously, as you move up in coverage, you're going to move up in pricing, right? The enhanced plan is what I highlighted there because I would say 8 out of 10 policies I see sold, you guys, are this enhanced PPO. Deductibles ranging from $2,500 to $25,000. Standard $1 million policy, same, big at a network. Okay. If you want some office copays and some prescription copays, we have that on the copay enhanced side, but you pay more in your monthly premium to get that. Wanted to at least show this to you. If you're selling in any of those blue states, we do have an HSA short-term medical option. Believe we are still the only carrier offering any HSA options for short-term. And as long as short-term medical continues on the track that it's been on, at least under our current administration, I think we plan to expand the footprint for our HSA eligible states. When you run a quote there specifically is an HSA option. So not every short-term plan would qualify. Look for the ones that specifically show that it's an HSA compatible plan. Okay. That's a quick overview of short-term medical. I hope there's some questions. I hope there's some things that I can answer either on this call or offline. But I did want to show you what I think is a really, really great tool. I hear from agents all the time that this is the easiest quoting system for short-term medical out there. If you're appointed with us and you log in, the URL there is at the top, ngahagents.ngic.com. That's back when we were National General Accident and Health before Allstate acquired us. But once you log in there, your name's going to be in the top right corner, like you see my name there. And there's there's a lot of quick links and brochures, state availability charts, all the things that you might need, a link to our YouTube channel there under the quick links tab. But the 2 arrows, the first one on the left, policies, this is where your book of business is going to be. If you write a policy with us today, that's going to show up under policies and it'll be stored there. So it just kind of keeps you organized, right? Knows what deductible you sold them, how much their premium is, what's their policy number. You can download the ID cards and send them right from this site. So a lot of the pertinent client data will be under that policies tab. And at the top of the page, obviously, what we use a lot in this industry, quote and enroll. If I were to click there, it's going to take me to a site that looks like this, and it's real just basic generic data, right? What effective date do I want? What zip code? What date of birth? What's their gender? And then I click that quote now button. Once I click quote now, this is our quoting system, guys. It's very simple, but I think the interface is very, very clean and easy to use. Short-term medical is the tab there at the top. And you'll see in the middle, the highlighted green area, I can choose a term length of 12 months. I could choose a longer one or a shorter one, depending on the state. This is in Tennessee, so I could choose up to 3 years of coverage. The single payment there is on the right. So if I wanted to do a 12-month plan or less and save that 20% discount, this is where I would do that. And all of our products are there on the left-hand side, right? So if I wanted to add short-term medical with an accident policy or a dental policy, I would just click that tab. And obviously those products would show up. You'd be able to add them to the shopping cart and off you go. As a quick side note, we do a ton of business with agents all throughout the country that sell a lot of ACA business, and they bundle our supplemental plans with it. So all of our accident plans, all of our supplemental plans can be sold standalone. They don't have to be bundled with short-term for you to make that sale. A couple things I'll call out here on the right side of the screen. You'll see I added into the shopping cart a short-term medical plan at $5,000 deductible 100%. And I also added a hospital expense protection plan. And then our accident plan is called Plan Enhancer at a $10,000 face amount. Total premium, $246.74. This is for a 35-year-old client in the Nashville area for a 12-month policy. Obviously, if you're not getting a big subsidy, it's going to save this client a ton of money. You, the agent, would have a couple options now. You could either click the green button that says apply. That means you are doing the app, right? You're answering the health questions. You're putting in the payment information. And once you get to the end, it'll ask, because you're doing the app, the client has to complete an attestation. We have a text attest option. So your client's going to receive a text on their phone. Hey, read me the code back. You type in the code and the attestation is complete. Much, much cleaner, much simpler than waiting for emails to come through. So just know we've really tried to make our system very simple, very easy to use. We know a lot of business gets done during the busiest time of year for you. So if we can save you 10 seconds, 15 seconds here and there, we know it does make a difference and add up. The second option there I just wanted to point out is the button right underneath the apply button that says email proposal. Obviously, that's if you wanted to email this quote to your client. Your client can then enroll completely themselves right from that link. Okay. So anything you put in the shopping cart, they would be able to apply for. I'd be happy to walk through any of our systems with you guys one-on-one or someone on my team anytime. If it's been a minute since you logged into the Allstate Health product offerings, I know I'm biased, but we have some great options, guys. ACA is the right play for some clients. I would argue it's not the right play for some clients. Short-term medical could be a really, really good fit for the right person. And me and my team would love to have you quote the Allstate Health option and see if they're the right fit for you. Alex, that's what I wanted to make sure we got covered today. I tried to keep it short and sweet heading into a holiday weekend, but I'll leave this slide up for as long as you guys want me to. Make sure you take down my email address or Sarah's email address. Reach out to us anytime, guys. We'd love to help you.
Fantastic, Carl. Thank you so much for going over that. I really appreciate that. We have a couple quick short-term questions here, which, considering you're still on, let's answer these, and then I'll go through the remainder here, and we'll wrap up and get you guys on to the weekend. So I can answer the first one. Janine asks, is the product in California? No, short-term medical is not allowed in the state of California. Carl, does it cover prescription drugs? I think I know the answer, but what do you say?
Yeah, good question. One caveat to California, we do have it's not short term, but we do have a fixed benefit plan in California. So if you guys have a client that might need something there, It's better. It's a lot better than going with nothing. It's actually a pretty rich option. So if that's something that could be of help, reach out. I'm happy to connect you to that brochure to see if it would help you. On the RX side, the standard policy, that middle plan that we talked about, really does not provide a lot of RX coverage, guys. The policy does have a prescription discount card that comes with it. From what I've seen, we also partner with a product called Recuro, Recuro. Recuro is an optional buy-up, and that actually has a really, really nice prescription option. It covers the top 200 most prescribed prescriptions, and it's a $0 copay. So Recuro, when partnered with short term, could be a really nice option. But generic answer, no. Short term doesn't do a ton to provide coverage for prescriptions unless you buy that copay enhanced plan or add Recuro.
Fantastic. Okay, and then Jeanette asks, is short-term 365 minus 1 day? I'll take this one. Yes, your standard year-long short-term duration is going to be 364 days. As Carl mentioned, and kind of what impressed me is how many states have the what's called tri-term plan available, which is 3 year-long terms back-to-back on a single application. Allstate has fantastic availability. Thank you for that again, Carl. As you can see, they're up to 36 months at a time in any of those states. In green, standard year-long plan is going to be 364 days. So good question. Carl, anything else you want to impart?
Be careful when you're blowing off your fireworks this weekend, guys.
There you
Behave
go.
yourself. Make sure you show up with all your fingers and toes or buy an accident plan from us before you do.
Fantastic advice. I appreciate that, man.
Yeah.
All right.
Thanks for having me, Alex. I appreciate you letting me join, and hopefully we can help your agents a little bit more.
Yeah, thank you so much, Carl. Appreciate you
got
so
it.
much for joining us today.
Thanks for having me.
All right, guys. So a couple more things before we wrap up here, and then we'll have a quick bit of Q&A at the end. I do know I have a couple questions here in chat that I want to answer. So first and foremost, if you're doing ACA, you got to do short-term medical. Carl put it best. This isn't going to be a type of product that works for every single client. I've talked with a lot of people that sell short-term. I've talked with a lot of company reps. I appreciate Allstate's transparency and saying, hey, if you're selling this to every single client, you're doing a disservice. The product is there because it works for some and it doesn't work for others. ACA is exactly the same way. It's great to have the option, but when you have your higher earning clients that aren't getting a subsidy, if somebody only needs a plan for a couple months and they're looking for something that's just sort of a safety net, maybe they're between jobs or traveling a lot and they need a PPO and the marketplace doesn't offer that. Short-term is a viable solution, especially now with those longer durations for clients that aren't going to have affordable coverage through the ACA. So putting it simply, if you're going to do one, do the other. We work with Allstate every single day, week, month, and year. So get in touch with us and we can get you hooked up. They're a fantastic partner to work with if you only want one carrier for ancillary and short term. We have some new ACA marketing pieces, which I'm going to show you guys in a bit. But again, if you want to get prepared, if you want to get ready to go well ahead of open enrollment, check your exchange. Whether you're working on a federal or a state-based exchange, we can get you the certification instructions. They might be not available during this time of the year, as Kathy said earlier, but we can make sure that you're prepared. And then not only get certified, but get knowledgeable. We have our entire suite of Green 365 trainings on the Agent Resource Center through our website. If you're working with us already, you are automatically enrolled to be able to get into that agent portal through jsaonline.com. Get in touch with me if you have any questions about that. That stands for Get Ready, Engage, Enroll Now, 365 days a year. We have all kinds of videos on demand for you guys to get trained up on your own time. Here's a quick example, a couple of the marketing pieces we have. If anybody is familiar with the Pro Shop, fantastic. And if you're not, you know who to call. This is where you have free, that's right, free to use marketing pieces that you can customize for not only ACA, but any kind of business that you do through JSA. We've recently updated our marketing suite with a ton of ACA pieces that you can customize for no cost. If you want to get them printed, you can use the convenience of Vistaprint right through the platform for a reduced cost, or you can go and print those yourself at, your home office, FedEx, Kinko's, whatever you need to do. Then coming up, we have webinars in every region. Like Kathy said, a fantastic one to join would be our ancillary webinar the very next week on hospital indemnity plans. plans. We are also having a summer boot camp coming to you. We will be in Texas in just 2 weeks, hosting an ACA boot camp, which is a half-day session, everything you need to know to get off the ground and running with the ACA. We'll be also doing California in August and Green Bay, Wisconsin in September. If anybody has questions on those, all of the links to the events will be in my email. If you're in the area, I guarantee you it's going to be worth the time. Come spend a half day with us. We'll even give you a little bit of lunch, and I guarantee you will find it useful. We're doing regular STM and ACA 101s. Check those out. And again, go and see what we got going in the Green 365 training area of the Agent Resource Center on our website. So, Q&A. Let me go quickly back here through the chat and see what kind of questions we have. Jeanette, you asked about the SEP and referrals. Again, ask about cross-sell. Get hooked up with Allstate, and you're going to have a fantastic suite of ancillary products that you can offer to anyone. Jeanette also asked, can we go over the difference between the Medico and Aetna hospital and critical illness plans? I won't be diving into any sort of product specifics today, but feel free to give me an email, Jeanette, and I'd be happy to send you some information on those. Or our 1-800 number is just 1-800-203-0433. Any of our team members can help you with ancillary. Janine, you actually have a great tip here. So Janine says, in regards to kind of like the scam emails that we were talking about earlier, Janine says, I vet by asking where they got referred to me. Great first step. Hey, who do you know? I'd love to give them a thank you. Did one of my clients refer you to me? Then, if they have vetted one that, you can't give that answer, just block it in your email, set a filter so that it goes to trash automatically. Fantastic option. That way you're not accidentally clicking on anything, even if you think that is a safe email. Good tip, Janine. She also asked, will we get these slides? Yes, you will receive a full recording of the presentation today, including mine and Carl's slides that will all be in the recording. So that will be coming to you probably this afternoon or sometime tomorrow. So just keep an eye out for that. Janine also said, I would love to hear more about the alternative to short-term medical for California. Like Carl mentioned, they do have sort of like a beefed up hospital indemnity offering there. We can certainly get you some information on that. And Carl said he'll email it to you. So thank you so much. I appreciate that, Carl. Timothy, thank you so much for joining us before the 4th. Happy 4th of July to you. Janine, thank you so much for your questions. If you would love to attend the trainings, go check out our website. That's jsaonline.com. You can see our events page. And I know that you're already working with us. I've spoken with you before, so I appreciate you joining us today. Go check out that Agent Resource Center. We got a ton of trainings on demand for that. Okay, Jeanette also asked, can I show the slide with my email and number? We'll be giving all of that to you in the follow-up email along with those slides. So we'll have that available for you. If anybody wants to call me, I'm just going to put these in the chat right now, make it easy on you. My email is afarron@jsaonline.com, and my direct line at my desk, maybe I'll start taking live calls on these, that would be fun, is right there. If anybody wants it immediately, I'm going to take a quick break after this, but then I will be in for the remainder of the workday. Appreciate you joining us, Jeanette. All right, and with that, we're under an hour. Like we said, we want to, keep it a little less today. We always end up being chatty, me and Kathy. So with that, I want to wish you all a very merry 4th of July weekend. Stay safe, like Carl said. Make sure you are staying away from those fireworks after you light them. If you're living in Colorado like I do, frankly, I hope you're not lighting them off because we don't need any forest fires here. And with that, thank you so much for joining us today. I hope everyone has a wonderful weekend, and I will sign off from here. Have a good one. Thanks, everybody.